No.
Now, tuberculosis is the leading cause of death from infectious disease worldwide after COVID-19. It's an infectious disease that mainly affects the lungs. The bacteria that causes tuberculosis is spread from person to person through tiny droplets released into the air via coughs and sneezes. Siaya County is one of the areas that is recording high TB cases, as Beldine Waliola tells us more.
At Agula Sub-District Hospital, we met Dominic Okelo, 45 years of age, who is recovering from tuberculosis and was here for a routine checkup.
Kitu lilianza mwezi wa nane last year. So nilijaribu kununua madawa, kwenda hospitali, sikupata suluhisho. Sasa kufika this year mwezi wa 3, nilikuja hospitali Agula. Nikapata rafiki yangu anaitwa Mary. So Mary aliniambia kuna watu wanakuja kutoka Nairobi, wanakuja kufanya screening Usenge. So wakati nilienda Usenge nikapatikana nayo, sasa nikakuja nikaanza matibabu.
The disease affects both the young and elderly. Josephine's grandson has been suffering from an unknown disease for quite some time.
Njeka sana for almost 2 years. Hatukuwa najua ni nini inamfanya. Sasa nikimpeleka hosi, tulikuwa natibu malaria, mwili moto, hatukuwa najua.
She was later glad that a proper diagnosis was made and her grandson is now recuperating.
Kwa sababu TB ndio iliua mzee wangu, kwa sababu hatukuwa najua ni TB. Sasa vile niliambiwa mtoto ako na TB, nilifikiria huyo pia ningejua angepona. Sasa vile mtoto anaendelea siku hizi, naona mabadiliko kubwa sana.
Tuberculosis symptoms include coughing for more than 3 weeks, coughing mucus or blood, chest pains, unintentional weight loss, fever and fatigue. Tuberculosis can also affect other parts of the body, including kidneys, spine or brain.
Siaya is one of the high burden for TB and of course HIV. Every year we register between 2,500 to 2,900 TB cases. Like 2021, that is last year, we registered 2,906 TB cases. So this classifies us as high TB burden.
Agula Hospital also records a high turnout of those seeking TB treatment due to its proximity to Lake Victoria, which is highly populous with fishermen. Training of healthcare providers has also come in handy in equipping the medics with proper knowledge of handling tuberculosis.
When we have contacts, we trace them to the totality, to the best of our ability. Some of the activities that we do that we could consider best practices is incorporating TB activities in our outreaches.
Have drug-sensitive TB and we also have drug-resistant TB. So in the programmatic management of drug-resistant TB, we support clinical reviews for our patients who have developed drug resistance to the first-line TB medication. So in the clinical reviews, we discuss management and also offer counseling to the patients so that at least they complete the treatment and have better outcomes.
One is advised to seek medical attention when they think they are exposed to TB, have unexplained weight loss, and have night sweats. Being consistent and adhering to TB treatment is also key. Beldine Waliola, KTN News.
Now, controversial Nakuru West MP Samuel Arama has been fined 1.56 million shillings in a land fraud case. Arama was found guilty in 6 counts of conspiring to grab a parcel of land valued at 60 million shillings from Ahmed Muhammad Nasir between the 3rd and the 11th of August 2015 in Nakuru. Arama was charged alongside lawyer Kennedy Onkoba, Ministry of Lands officials John Muiri Moura, Daniel Nyatsika and Charles Burundi. Anti-Court Senior Principal Magistrate Victor Wakumile ordered the MP and his copy pay 260,000 shillings for each count they were found guilty or spent 6 months in jail. Now, the Kenya National Commission on Human Rights has released a damning report showing how public officials are using public resources from the Women Empowerment Fund and the Constituency Development Fund, CDF, for campaign activities. The report also notes that some of them are using government-registered vehicles for their campaign activities. The rights body KNHCR has documented 47 such cases, which it intends to disclose in a detailed report to be released in July. Now, additionally, the Commission has observed 149 cases of voter bribery spread over 8 counties, as Judah Ben reports.
Taxpayers' money is facilitating politicians' way to public office, says Kenya National Commission on Human Rights Chairperson Rosaline Odede. The Commission's investigation has found over 47 cases of misuse of public resources, contravening the Election Offences Act that prohibits a candidate or any other person from using public resources for the purpose of campaigning during an election or a referendum.
The Commission continues to document use of public resources by aspirants and candidates during campaigns, this giving them an undue advantage over others. The Commission further notes with concern the use of government-registered vehicles and public-funded programs such as the Women Empowerment Fund and the Constituency Development Fund in campaigns, contrary to the Election Offences Act.
While monitoring the political process, the Commission has found that a significant number of Kenyans from 10 counties, among them Lamu, Garissa, Marsabit, Baringo, Mandera and Nakuru, are unlikely to cast their vote in the coming election as a result of violence in different regions across the country, prompting their migration to different areas.
The Commission notes with concern there is an ongoing displacement and involuntary movement of persons out of the affected areas, with the potential of affecting the voting patterns and the ability of the citizenry to cast their votes. The Commission further notes that as the political activities heighten, there is a corresponding spike in criminal activities.
The Commission has also criticized politicians and political parties for meting out attacks on constitutional commissions and independent offices after some candidates failed to be cleared to run for office. KNCHR has condemned the involvement of school children in campaign activities, arguing that it exposes them to potential danger and diverts their attention from schoolwork.
The Commission has documented 101 cases of use of children in political activities and disruption of learning activities, with the highest prevalence recorded in Nairobi, Kiambu, Kilifi, Mombasa, and Nyamira.
Odede has also called on the Independent Electoral and Boundaries Commission, IEBC, to enhance public trust through open and transparent communication for voters to meaningfully engage in the electoral process. Judah Ben-Ha, KTN News.
Now, and 5 victims of deadly Embu brew last week were today laid to rest in a mass burial in Embu County. During the ceremony, residents urged relevant government agencies to move with speed and end illicit brew, which they said had claimed many lives in the county. Clement Masombo has that story.
Burial mass for the 5 people who died last week in Embu after allegedly consuming illicit brew was held today in Karuku village in Mbeere South Sub-County. The 5 died after taking the deadly liquor produced by a local businessman in Embu County. During the burial ceremony, locals made a passionate appeal to various agencies to up their game and end illicit liquor in the area.
Ile tunaomba serikali, wale watu wanao kibali cha kuidhinisha hii pombe haramu na wale watu wanao kibali cha kuangalia pombe inayouzwa katika hii area wako, lakini tukiangalia wamekuwa na ulegefu sana, kwa sababu kama wangekuwa wameshika laini makini kabisa, sasa tungekuwa tunaomboleza kifo cha watu wetu.
Kabla mfanye maneno ingine, mfikirie vijana kwa njia kubwa, otherwise hatutakuwa na future generation in this country sababu ya laxity. Na ndio unaona watu kama Wajakoya wanapata umaarufu na dakika chache sana. Why? Sababu ya hopelessness yenye iko hapa.
Last week, Embu County Commissioner Edison Nyale refuted claims that the 5 died after consuming illicit brew. According to Nyale, the 5 could have died after feasting on crocodile meat, which they had ordered in a local restaurant a few moments before embarking on a drinking spree.
Na pengine ni ile nyama ambao wamekula, because unapoonja unakula nyama ya mamba, huwezi jua unakula blada ama unakula nyama yenyewe.
Following the tragedy, police arrested 2 suspects linked with the manufacturing of illicit brew.
Somebody somewhere is not doing their job. I think it is a tragedy. And this is the price you pay.
Mimi ningeomba serikali iingilie kati kupitia utafiti wao kwa mabaa zote, sio tu ati kwa Karuku, juu hakuna pahali kunafaa kupotea mwananchi.
Clement Masombo, KTN News.
Now, the impasse that almost saw private hospitals withhold services from members of the National Health Insurance Fund NHIF early this year seems to be over following an agreement between the health service providers and the national insurer on proposed fees in their new contract. NHIF says the strategic standardization of hospitals' contracts will be key in ensuring quality of care, efficiency and productivity, which is critical in the attainment of universal health care coverage in the country. Gloria Milimu reports.
The new contract for the year 2022-2024, according to NHIF, accommodates concerns of Kenyans through standardization of reimbursement rates across all NHIF-credited facilities. The contracts are either comprehensive, where members will walk in and out without paying for services, or non-comprehensive, where they will be required to top up for services.
We have also expanded the scope that covers, one, the medical outpatient cover has been enhanced to cover 7 categories of essential basic lab tests and payment model risk adjustment for the 5 most common non-communicable diseases. In terms of medical inpatient, the reimbursement amount has been enhanced by an average of 12% and standardized across all providers. In terms of oncology benefits, this has been expanded to include bone scans and radionuclide therapy, access to PET scans, and access increased to 3 providers. You recall that initially, PET scan was only available at the Aga Khan Hospital. Now, the service has been availed in GOK facility, that is the Kenyatta University Teaching and Referral Hospital. And also, there is a faith-based facility in Kitui.
What we have sat here negotiating for that time on comprehensive is to have pricing on surgical packages, on oncology packages, on other medical packages, so that every Kenyan can enjoy that service on the comprehensive contracts.
Initially, private hospitals were opposed to the new fees, decrying the amount NHIF was willing to pay for services rendered, saying it was not feasible. NHIF says members will access these services